Yo, what's up? I'm Coach Rich Thurman, also known as Coach RT3. Today we're at Kauno SF in San Francisco. It's a physical therapy clinic where I do most of my personal training. Today I'm here with Yana, and today we're going to talk about external rotation of the hip. Before we get started, make sure you smash the subscribe button so you never miss a post from me again. All right, let's get it. So when you're doing yoga, for example, you're looking at doing things like Pigeon Pose, and oftentimes Pigeon Pose places a large demand on external rotation of the hip. A lot of people don't have the necessary external rotation of the hip to be in that position. So oftentimes what happens with a lot of the yogis that I end up training and seeing is that they're looking for an understanding as to why their hips or their low back might be giving them a little bit problems. And oftentimes, control of the hip is lacking. So oftentimes, I'll have a yogi who has a lot of range of motion, so I can get them into a lot of passive range, which is a lot of what's happening when you're in the pigeon pose. But then when I ask them to do active range of motion and I assess their active range, what happens is they end up short. That tells me a little bit about what's going on with their hip. So they have all of this passive range, but there's this window where they don't have control of it. Now, it's important for us to understand that having control of your range of motion is an important aspect. We don't want to end up in a position that we're out of control. So what we want to do is we want to get that person to learn to control that. So what I might do is I might bring Yana to this position here. This is her passive range of motion. This is her potential for strength and movement. All that gap right here is room that she doesn't have the ability to connect her brain to her stuff that's moving her into this position. So I might say, hey Yana, can you hold this position here? If she can hold that, great. But sometimes what happens is immediately when I let go, it's like a rubber band. Boom, goes right back to that position that it's comfortable with. If that's the case, what I might do is I might do some positional isometrics here just so I can get her to understand how to contract the tissues that are here. So I might hold here and I might have her rotate this direction and rotate towards me, giving me a little bit of force that way so she can learn how to contract that stuff on the back side of the hip. And then I might have her rotate the opposite way or try to connect with this stuff on the front side of the hip to try and rotate further into this position here. I might give her a little bit of resistance here, so I might give her a little pull so she can feel what it's like to resist that. And I might give her a little push here on the backside so she knows how to push up against something going that direction. Isometrics are a great tool that you can use to help people fill in the gaps of strength that they might be missing. If you found this video useful, smash the subscribe button so you never miss a post from me. Be sure to like this post and share it with a yogi that you know that might need a little bit more control of their range of motion.